So I'm Milan Pia, current president of AMDA, and this is the second in the series of our webinars around starting your medical career in Australia. So few points before we start. So we've asked for questions beforehand, and we've got a list of questions. So we will try to answer them in the webinar today. You can also ask questions via the chat function. We would prefer if we didn't have live questions because of the time limit. And we've actually refreshed our website. So we have some information on our website. So if you go to anmda.org.au, you should be able to find some information. We will also upload the recording of this webinar as well as the last one if anyone missed it for your viewing. You don't have to join membership to see these webinars. We'll make it freely available. I'd like to remind people about our membership structure. We have general members, which is $75 a year. And we are hoping that people who are working as medical or dental professionals within Australasia join our organization. We also have associate membership, which is $5 a month, and this is a year. And this is mainly for people who have passed their AMC1 exam and are currently resident in Australia. So I think if you are still in Nepal thinking of coming to Australia, probably not worth joining just at this time. But once you're in Australia, we would welcome you to join. So I'm delighted today to introduce Dr. Bibhu Pradhan, who is going to be moderating the session and will be introducing the speakers. Dr. Bibhu.
Welcome everyone to our second webinar in our series of helping our new IMG doctors from Nepal. My name is Dr. Bibhu. I'm a senior staff specialist, ED staff specialist in various Sydney hospitals across Westmead, Concord and Ryde. I'll be moderating the session. We'll be dividing the session into three parts. First would be a brief discussion about CVs. If there are pertinent questions, we may take around 5 minutes to discuss the questions. We may not be able to take all the questions. That'll be followed by discussions on strategies to help you improve your interview skills, and followed by some tips and tricks about interviews. Time permitting, we'll be going ahead with some more questions if you have, or we'll have some panel discussions about interview issues for junior doctors in Australia. I know there's been a few questions already online, and we'll see if we can help you with them. Some of the questions we've looked at are very specific. I think there's a disclaimer already on site, and Ram is going to put in as well, where we're practicing clinicians. We're not affiliated to AMC or any of the recruitment organizations, so we won't be able to exactly give you all the answers. That's going to be up to date. These are more strategies we know IMGs face, or the problems IMGs face when we are in the interview panel. I think Ram's got it.
Yeah. Okay. Sandesh, you got the control over the slides, yeah? Good. Yeah. I can see the screen. Yeah. All good. Yeah. Okay. Thank you, Bibhu, for introducing me. So welcome to this webinar. So I'm just going to probably talk about in the next 10 minutes about the medical resume, or how to write, how to optimize a CV. Obviously, you're not going to get a job over somebody who's overqualified or who is more skilled than yourself. But I think if you optimize your CV in a proper way, if you put the information out there, the way that the prospective employer is looking and what the prospective employer is looking for, at least you may get a chance over the people that you're competing at the same level. So next slide. So on this next slide. Yeah. So saying that, I'm neither a career counselor nor not a resume expert. So please use this as a guide. And this is purely based on my work experience as a junior doctor. And I've been in Australian healthcare system over the last 15 years, starting as a junior doctor, going through the training program here and then working as a consultant now. And I'm involved in the recruitment at the senior level at the moment. So next slide. Okay. So historically, resume is a shorter document as compared to the CV, but that distinction is not relevant anymore. So these terms I use interchangeably at the moment. Next slide. So talking about medical CV in Australia, you may come across the fact that different state, territories, and authorities like an APRA or any programs may have different resume formats. But this is your first impression to the prospective employer or the program that you are hoping to get into. So you want to make this as clear, as attractive as possible with what you got. Obviously, we can't put things that don't belong to you, but at least if you can present what you've got well, and it might catch their eyes, and you may get selected for what you're looking for in the near future. So, basically the basic principle of the resumes is that it has to be very clear, and it has to be designed in such a way that it's easy to scan for the information that the employer is looking for. And it's very important that you give or importance to checking spellings, justification of the words, font size, bolds, italics, underline, caps, boxes, whatever you put, however you format the document, it should be appropriate and and not too clunky. It should not appear too clunky, and it should not appear too flashy either in terms of color combination and things. Okay, next slide. So the bottom line of as I mentioned earlier, different state and then authorities may have different format, but the bottom line is they will all have a kind of domains that every CV starts with their personal details. And you don't necessarily have to have the title as a resume or a CV. You can basically write your names and followed by your maybe your email address and the phone number at the top of the document. Followed by the qualifications. So whatever qualification you've got, either you just got a primary medical degree like just MBBS. If you got any other international degrees, like if you've been to UK and you've got MRCP, and you can put those. And if you've done EMC Part 1, EMC Part 2, or even an English qualification, if you got IELTS or a PTE or OET, you can put in those. But I think anything beyond that, I think I've seen some of the observer that have come and done observership under us. They put in the the qualification like about where they did high school and then primary school, those kind of stuff. That probably not so relevant unless you studied here in Australia and then you've gone to James Cook or you've gone to Sydney Grammar, those kind of stuff. But I think for international medical graduate, that is probably not relevant. So that should be followed by what is your registration status at the moment is like now which countries you got the registration, whether it's be Nepal or if you've been to UK, you've got general medical registration, general medical council registration there. You can put in those, or if you pass your AMC Part 1 and Part 2, and then you're eligible for limited registration, provisional registration, whatever they call, and you can mention that you're eligible or you can apply for those. On top of that, if you got a residential status in Australia, be it in the form of permanent residency, or citizenship, or if you got some sort of working rights, it's probably worth mentioning because, basically when they are looking at somebody's CV, if they know that is an international medical graduate, the next thing they will be looking at is whether they need to actually go through the hoops of sponsoring this person through immigration and then waiting for a couple of months to get their visas and how soon you can start. So this is something that the hospital will be looking into as well. So if they find somebody who is got who is qualified and probably already got a working right, that they don't have to go through the hoops of jumping the hoops of immigration, then you probably get a better chance. So I think you better mention that, especially if you got working right in Australia. If you don't have, and if you're on tourist visa in Australia, you don't have to mention it. You better don't mention that. But if you think it's going to work in your favor, I think I would suggest mentioning that early in the first page of your resume. So personally, I think the skill domains is probably the most important part of a CV. Obviously, as doctors, we all, I think, when we say a doctor or when we think about doctor ourselves, I think main thing comes to our mind is our clinical job. But that's only one part of the skill set that the Australian healthcare system is looking for. Obviously, that's probably the most important one. So, but apart from the clinical experience, the other thing, other domains that are actively looked into or are taken into considerations are like how much teaching learning activities you are involved in, quality improvement projects, what are your achievements and attributes. So I'll tell you why, because I mean, obviously, clinical experience you put in the reverse chronological order. But the Australian healthcare system and the training in the postgraduate time is trainee driven based on the college curriculum. So your resume reflecting your teaching learning activities will reflect your passion or your commitment towards self teaching learning or self driven teaching learning activities. So you should mention that you're committed to this. Similarly, like it's not only providing the clinical care and then going up the ladder on your career. When you're working in the healthcare system, they expect something in return on top of your daily clinical work. So they want, if you are part of the clinical workforce, they want you to be contributing a bit more just beyond your day-to-day clinical work. So they want to see whether you've got any qualities in terms of research, audits, work, related quality improvement projects, be it just like a clinical audit on like on some patients or some patient demographics or even morbidity mortality meeting, those kind of stuffs. So if you got anything that that you are involved with, I think it's worth mentioning. And finally, your achievements and attributes, like in terms of your involvement in hospital committees, your awards, and your personal interest as well. Milan and I was talking about the other day. Like, I think when we go through CV, Milan and I'm involved in recruitment of the advanced trainees and consultants sometime. And then when we look at people, like obviously everybody got similar clinical experience, and then they're all involved in a teaching learning activity and some sort of a clinical, or quality improvement project. But what sometimes distinguishes these people from being hired and not hired is what are their personal achievements and attributes are, and what are their personal interests are, whether they can fit in the department, especially. And it matters when you are actually, getting into the advanced training or the consultant job, which is like looking into as a, being a permanent fixer for the institution. And the other part is referees. I've got a separate site for referees as well. Referees is really, really important. And they usually look for at least 2 to 3 referees. Um, you know, uh, Referees are really important because obviously these are the people who are vouching for you to get into the work environment which you never worked before. So these people, whoever is a prospective employer, needs a bit of reassurance that they are hiring a right guy, and on top of what they see in the paper. So while you're choosing the referees, be mindful. See, Sandesh, can we go to next slide? So while you're choosing the referees, I think talk to the referees beforehand. Tell them that you're applying for the job, and choose a referee who is ready to give you a good reference. It doesn't matter whether they're a professor, but if they can't check their emails on time, and if they don't pick up the phone when their prospective employer is calling them, there's no point like putting a professor as a referee. As long as they are 3 or 4 years seniors to you, they're at least in some sort of specialist training program or a junior consultant. So as long as they can give you good reference, that's the most important thing. And they should be happy to take the call and reply the email on a very timely manner. Like they might just ask for a referee report, and then if they don't get response within like 2 or 3 days, then they think that probably the referee doesn't want to give the reference, or doesn't want to support the application. So choose someone who is readily available or who can reply to those calls and email on timely manner. And if you got a local referee, you use the local referee. Like, and even if you just done observership, like for maybe 3 4 weeks, if you done some attachment, even attachment with a general practitioner, use them as at least one reference. Because I mean, somebody who has been in contact with somebody who's locally working, the credibility is higher. But if you have come across 2, 3 people locally here in that manner, I wouldn't recommend putting 2 or 3 people because they can't really comment on the clinical skill. So in general, the rule is one of the referees should be a current or the most recent employer. One probably from maybe last 12 months, and then the other one could be of your choice. Okay, I think there is a question about the gaps. If you're applying for a hospital job, you don't necessarily have to apply explain your clinical gaps. Like I think, but if it's for APRA, I think the APRA has got a separate format. I think I've got a couple of extra slides here which shows how different state has different format of the resume. And I think APRA specifically asks for the explanation. Because I mean, it's from the registration perspective, I think they need to make sure that this guy was not involved or in any other activities or out of medicine. So they want to see that clarification of what you've done during your non-clinical time. But if you're applying for the hospital job, you don't necessarily have to explain all the gaps in between. If they ask in the interview, you can explain like what you did, but you don't necessarily have to explain those gaps in if it's hospital is asking or if you're applying for a hospital job. So I put in a couple of examples how like in different state have got different CV formats, but they're pretty much similar. They may have a bit of boxes up and down a bit, but in essence and bottom line is um, you know try to categorize the information into different domains so that when they go through the CV, they it catches their eyes. Because when if there is a application for a resident, there are 5 positions and then there are 20 applicants. The person who is looking at the CV will literally have maybe 20 or 30 seconds to go through your CV. So you just want to make that information very visible to them. Next slide, Sandis. And this is basically the formats of the different CVs from different states. This is one piece from Tasmania. But at the end of the CV, I think there is because there is a bit of a verification statement that you have to put in a kind of a statutory declaration that what you documented is true, and then put your name, signature, and the date. Next slide. So this is one from the Queensland Health. So you can find them in the website. And some of the campaign or the application would have template given at the time of the application as well. When you open the application pack, they usually would have it in a CV template. So please put an effort to convert your CV. It's probably the same information, but put an effort to convert those information into that format, because they will see that if you put an application for Queensland Health and then you use the Tasmanian format, they will say that, oh, this guy didn't even put the effort to transcribe the information into our format. So is not taken in well. Okay, next slide. Basically part of the Queensland Health. Yep. Next one. Next one. So this one is the one from APRA. Basically, this is where they ask for a bit of a bridging program. You qualify and a qualifying examination, and then there is a bit of section for explaining your gaps in the work of the clinical history as well. Yeah, next one. I think that's probably it from this. Yeah, I think this is just an example of one of our observer who's been with us currently. Like, see, this is something that she's modified after coming to Australia. But it's still, we gave her some feedback on how we can improve. You can move on, Sandis. I think, we're running out of time and we need to move on, I guess. Do we have any other questions? Yeah, I think there is a question about can we put non-medical work experience? Like, I think you can mention, but obviously, like if it's remotely related to medicine, if you've done some research assistant job, or even if you've done some like ASK work, or like phlebotomy job, I think in anything related to the medical, you can put in. At least that gives you at least a big advantage. Like if you've done phlebotomy and if you're looking for an RMO job, they will know that at least this guy will be able to take blood and put a cannula easily. So there will be some advantages. So this small skill may count when when you're competing with people of similar caliber. In terms of the reference, definitely, like, if you got one local, definitely somebody who can comment on your clinical skills. Like, Milan Dai and I run a small program on observership, like, observership for those who have done, EMC Part 1. And when they finish the observership, like, we tell them that they can use one of us as a referee, but we can't really comment on their clinical skill because they're not actually allowed to touch patient, even though they are able to interact. Definitely use somebody who can comment on your clinical skill as well, please.
Bibhu, I think we move on in the interest of time.
Thanks, Ram, for an excellent talk. There are a few questions. He's been able to answer a few. There's still a few questions coming up, and we'll try to get to that a bit later if we can, just because of our time constraints. Just a small point after how you make the CV. Now, he's already shown different formats for different states, and I can only talk about New South Wales because it's been a while since I've worked in Victoria and South Australia. But all of them have similar websites where I think someone was talking about RMO recruitment program, which happens once or twice a year during the intern intake. And there's a residence registrars, astronomers, different levels are recruited. Now, most of them have a very standard pathway where you put all your details in, including attaching your CV, putting your standard details, which are pretty straightforward. Then there's about 5 to 7 questions you've got to answer. Some of them are repetitive, but it will be like, tell me about your clinical experience. Are you a team player? Something like that, and what are your priorities and something like that. Just make sure, just because you don't know doesn't mean you shouldn't fill it. Okay, so get some help from someone, look up online, but put something in. If you don't put in, you're really low down the list. So always fill those boxes. The HR manager will look at that and say these are not filled, you'll be down the list. Just be wary of that. I couldn't find an online version for some reason, which is interesting, but those of you who have applied in the RMO campaign will know what I'm talking about. A few more questions coming up. Look, the reality is we're just talking to, when I was a director for IMG clinical program, I was talking to some of the IMGs who were lucky to get involved. Look, someone's got a question about this is the last page or the second last page on the New South Wales JMO recruitment website. And it says, do I have authority to be positioned? Do you have restrictions? Look, if you don't have any, if you don't have a general registration or a temporary registration, it probably doesn't matter. And most of you will be in that boat, right? So if you've already got a provisional registration, well, you will have authority to prescribe all these. So it doesn't matter. Basically, what they're asking is whether you have any restrictions from a work perspective because of legal issues in the past, some drug prescribing issues, some of those issues. Those are just tick boxes. It actually wouldn't matter from that perspective. What you write in those initial boxes about all your descriptions and the quality of your CV is probably going to matter. All right, we'll talk briefly. I didn't want to overlap Bikash, that's why I was waiting. So some of the things you need to remember is what kind of interview you're going to. Most of the JMO recruitment program interviews now are happening online. Some of them will be in person as well. So if there's an option to go in person, you should try to go in person. But if it's online, just make sure your IT stuff are ready. You've got a quiet room where you're not getting disturbed by. Yeah, so just be wary about the simple stuff on the day of the interview. Remember, you've got about 200 applicants probably for a couple of seats. And so if you're getting selected or shortlisted for an interview, you need to make sure that you've actually prepared your best for the interview to be chosen. On a bad day, you might have people who've got 5 years experience applying for the same job. Well, it's very unlikely you'll get the job unless they really mess it up. But if you have the slightest of chance, you need to make sure you maximize it, right? There are about 2,000 IMGs, I was told, that was looking for jobs, and there are not 2,000 jobs aren't available in Australia for IMGs. So it's a very small market you're fighting for. So if you're in person, things to remember, be punctual, be well prepared. Professional attire, you don't need to be wearing a super fancy suit, but just make sure you're formally dressed. If you want to wear a tie, that's fine. But if you want to be smart casual, that's also fine. But if you're comfortable wearing a tie, for girls, being in smart casuals, that's probably better. You need to practice questions in advance. Bikash is going to go in details on that, and try to practice those questions either with another person or in front of a mirror, or someone who probably is already working. If you know someone who's working, try to do it online, try to do it in person anyway, just to get some feedback on how you do. Okay. You need to be aware of the differences between online and in person, how to reduce your stress effectively. When it comes to questions, there are books. If you Google interview skills for interns, you easily find, and I can share that there's an online book that's free. Usually the UK guys have it because, they're a lot more formalized there, unlike Australia. In Australia, we're pretty casual. So those are the questions you can prepare. There are some model answers you can use to format it for yourself. Simple things to remember about interview skills, especially if you're online, because what happens with online, I find, is as IMGs, our deficiencies really stand out when you're online. When you're in person, you've got your body language that shows you've got an eye contact. Online, you're just looking at the screen. There are like 5 or 6 people in the panel, and you just see tiny people. You don't know who they are, right? So you just got to be careful. So things to remember, clarity, how much time you're spending in each question, what's your tone and cadence. Just remember to try to practice these. Now, English isn't our first language, and for those who are just recently coming to Australia, you don't usually sit down for these formal interviews here, and it's obviously slightly different compared to Nepal, where the people who are interviewing you for them, it's not English isn't the first language. For you, it's not English isn't the first language. Culturally, it's very different. Culturally, it's different. The way you speak matters. What you say matters. I've been in an interview panel where I thought the candidate was great, but the panel member said, well, I have no idea what he said, right? Because although they were trying to say the right thing, just couldn't understand it just because of the accent. So just be wary of that. The other thing is, the use of AI. Now, when I was a director in ICRP, we discussed in detail about the use of AI by candidates. There was discussion on whether that should be banned. I said, well, there's no way we're going to ban it, because it's just going to get more and more ubiquitous, right? And I don't mind you guys using it. You just need to be careful about what you put in. If you're using it for your application, that's fine. But being on the other side, in 5 minutes, I'll know if you put in AI or not, right? So you need to, the things you can use it for is grammatical errors, because even working for over 10 years, my written skills are not as good as an intern here. It's just the way it is. Unless you're a PhD or a professor in English from Nepal, the likelihood is that the quality of your construction is never going to be as good as an intern or resident here, right? So using that to construct the words, making sure your annotations are correct, your grammar, your spelling, simple things that doesn't take a long time. Those are the things you can try to include. If you don't know what the question means and you're trying to figure out what it is, you can ask AI, but it needs to make sense when you write it. For example, if you are asked, are you a team player, and you put into AI and you said, well, I am a team player. I like to be a active member of the team and communicate well with different departments, including the general manager, the department heads across multidisciplinary team. Well, you're lying about it, right? You're an intern or resident with barely any knowledge about management issues in a hospital. So just be careful about how you cater it. Ideally, you want to put, even if it's a basic information, about just what you've done previously. Okay. Again, things to remember: get all the questions you can. Try to practice them. This is the one chance you have to get a job. You are probably one of the 200 or 300 candidates that's been shortlisted. You've been shortlisted to probably 10 or 12. Other things to remember: if you've written in the CV, don't expect the panel members to know about it. None of the panel members know about it. They've just been told a week in advance that they're going to be a panel member. They'll just rock up there, right? So if you have a question and you've done, say, for example, you've got some experience about research, doesn't matter if the question asks you or not, just put it in. For example, you say, what do you want to do? Just put in through, well, my interests are these. Previously, I've done these. I've actually been involved in some audits in the hospital because I like quality improvement. And that will highlight you. That will make you stand out among all the other candidates who are just going to talk about medicine, right? So things that will make you stand out. Just remember those things. Okay. Just see if you're ready.
I am here.
Okay, we haven't got your video. A couple of questions about applying for jobs. And I think it's quite common for people to apply for lots and lots of jobs and not get an interview. in this current climate. There's quite a few. I think when I spoke to somebody who does shortlisting, I think they said there was like 200 or 300 applications for one job. So it is quite difficult. So I guess it's quite frustrating, but I think the answer is basically keep applying. If you are definitely wanting to come to Australia, you just keep applying.
Okay. Sorry, I can't see any of you now that I'm on the screen. I'm sorry for the glitch. I think this is a common scenario nowadays when we do the interviews. Hopefully it will go smoothly from here on. Thank you for the introduction, and thank you for all the participants who given your time to join this session. Once you are in interview, means you've won half the battle, but still it's not over. It's a skill as well, and that's why we're talking about how to improve your job interview skill. Again, as a disclaimer, I'm also not an expert on this field. I'm presenting this based on my own experience, a number of years where I had to go for interview. And now I also am in a committee where I select candidates and also do the interview. But I'll try my best to give you some tips and tools which should be helpful to doctors of all level, mainly targeted at the junior doctors, and can be also helpful to seniors as well. So the next slide, please. So the whole aim of interview is to ensure that the doctors that they are hiring are safe, they are reliable, and they would be a good fit for the team. And it's not that easy to find the doctors from the CVs. So that's why there's another layer of interview to see whether they fit all of these criteria. Next slide, please. Sorry, I can't hear you. Is the slides moving all right?
Yes, I think it's in the next slide. Yeah.
Yeah, okay. Sorry. Just 1 second again. Yeah, so I'll just go through some basic tips for preparation. I think it's important to know a bit more about the post that you are applying. I've heard or experienced people, they apply for random jobs just because they are so desperate to find a job. The jobs or the doctor positions that are usually available in Australia are either HMO, RMOs, which means house medical officers, or junior medical officers. And once you've done few years of work, or if you are applying for the training, then there are registrar posts, and the senior post would be consultants. And some of the posts are CMOs, which is career medical officers, and these are for people who are a little bit more experienced. That's why, depending on your level, you need to know which job or post you are applying for. And also need to do a basic research of the hospital and the programs, the programs that are available in those hospitals, mainly because it will then show that you are interested and you've done your basic homework. If you have access to hospital website, it's also good to know the hospital values, and sometimes you may be asked questions related to values. Even if they don't, you may be able to use these values into answer, and which just shows that you've done your homework and you are more interested to work in that hospital. Obviously, you have come to this interview stage because your CV has been very good. and then you are in the next stage. But that doesn't mean that they won't ask about your CV. So be prepared to discuss all the clinical experience that you have cited on that CV. And also like prepare some basic answers or clinical scenarios from your own experience. And then it is easy to talk to, especially during the interviews if you are asked about certain events. Again, people think that it's just an interview and you may be able to do it well. But I would always suggest that you practice it loud before the interview on the some of the common questions that are asked, and it will be a lot more easier during the actual interview. Next slide, please. The interviews in the past used to be mainly face-to-face, but nowadays, especially after the COVID, the online interview has become very popular, and especially people for overseas, there's no choice other than the online interviews. And then that's why if you are going for an online interview, make sure that you have checked the connections, the software that are required are installed and working well. There are a number of platforms that they use. The ones that I'm familiar or we use more often are Zoom and Teams. And I'm not sure if they also use other platforms like Fiverr and WhatsApp. Sometimes when you are doing an interview through the online, there may be little glitches like we encountered today. If that happens, they may try to get in touch with you through other messages or even email. So make sure that you've got access to those. And if there is a delay, either check those messages, or even if you are delayed for whatever reason, make sure that you communicate that in a timely fashion. And if you are in a room, make sure that you don't get disturbed unnecessarily. Punctuality is very important, and that's why if you are ready for interview, at least be prepared and wait at least 5 minutes before the start of your interview. Dress up smart and rest well as well. This is mainly for those people who may have been doing nights and then they stay awake the whole night and get ready for the interview. If you can avoid that, then that's okay. But if you can, try not to do that. So have a good rest so that you can think clearly and answer appropriately as well. Next slide. Once they start asking questions, just listen carefully. And it is possible that you may not understand, especially if this is a remote interview. Feel free to ask again if you don't understand, rather than just answering, hoping that that's what you've heard. If the questions are not clear, again, ask to repeat the questions. It's good to have a eye contact. Obviously, that's what we do when we are face to face, but in the screen, sometimes people may be distracted or looking at other areas without noticing that. So be mindful of that. Whenever you've got we're answering, make sure that you've got a good structure. And there is a slide where I will discuss in brief about some of the structures that might be of help. Again, try to be very relaxed. It is an interview, it is for a job. People can be overwhelmed, but I think it's very important just to keep calm and be relaxed as much as possible. Non-verbal communication is also very important during this process. Next slide, please. Now, whenever the interview starts, there is a high chance that they will ask about yourself, even though you've written most of the things in your CV. Still, the practice is that they will ask a little bit about yourself. And that's why I think it's important to have a brief or a few lines about how you describe yourself. And also they would ask the reason for applying the job. If you are ready with that, again, it will be very natural and you will look more confident. They may also ask your strengths and weaknesses. Usually the strengths you can highlight on those, but weaknesses, if they ask, you can address or talk about it. If they don't ask, you don't have to. But when you talk about yourselves, I think it is good to highlight some of the strengths that you have. And it will also help to see why you fit in that role. Next question, please. There are different domains that they will test during this interview process. And the way that they do is using like testing your medical knowledge, and they will use different clinical scenarios to test one medical knowledge as well as also other domains, which also you down in the next slide. This is just an example of some of the clinical scenarios that are commonly asked. That doesn't mean this is the only scenarios they use. There are so many different scenarios they can use. And sometimes they also show you an ECG either to interpret on its own or in the context of a clinical scenario, for example, AMI or the arrhythmias. Sometimes they may also give you an X-ray to interpret and also ask about further management based on the X-ray findings. Next slide, please. And the other domains are like patient safety concerns. For example, somebody is very unwell, and then they would want to know your knowledge of how you're going to treat that patient and how you escalate. Getting help and escalation early is what everybody likes to know. Obviously, these jobs are mainly for junior doctors. They don't expect you to know everything and be ready for all the skills. And that's why it's important that at least you show them that you've got the basic knowledge, and then you ask for help if you feel that is out of your depth. That also tells them that you know your own limitation, and you ask for help when necessary. They will also be testing your communication skill while you answer the questions. Obviously the interview would be in English, but they will also ask or test about the different skills that are required. They may also ask you to give an example of a situation where you worked as a team player, and also like prioritization, self-awareness. They will be testing during this interview process based on the clinical STEM. There will be multiple questions to test all of these domains. As I said before, it's very important that you feel or make them know that you're very motivated, you're fit for that role, and that will be based on obviously your knowledge, your skill, and also the other extra activities that you done outside your work. And sometimes, especially for the registrar positions, they may also ask ethical decision-making questions. Again, some of the thing that they take highly of the ease of the consent and privacy. And then that's why, for example, if you are doing any procedure, also make sure that you take the consent, you maintain a privacy, and that will show that you are quite reliable, and then have some knowledge of the local healthcare system. Next slide, please. Once they have asked the clinical scenarios and most of the other questions, you will also be given an opportunity to ask questions. And this is the time that you can utilize to, one is ask questions if you have any doubts, or if you want to have any clarifications, especially of your role or how they're going to support you and things like that. You can also ask about supervision, what are the training opportunities, and also the well-being support. These are just an example, but the opportunity is there for you to ask, either to clarify or even to show your enthusiasm that you are really interested in that post, in that hospital. And now coming back to the techniques, we always feel good when people answer in a structured manner. There are different structures of answering different questions. If it is like a resuscitation or clinical scenarios, people find it very easy to have a ABCDE approach, like airway, breathing, circulation. So this is not the only structure. There are different structures. So try to come up with a structure that best suits your capability. And if they ask you about the management questions, start with some basic initial investigation, and you can build up on that. And similar with management questions as well, give the basic important life-threatening or life-saving treatment first, and then you add on to the next level. Don't give very hi-fi answers, and you are missing the basic answers, like even giving oxygen, giving glucose, or even giving IV fluid. Depending on the questions, it's always good to have a very good differential diagnosis. Again, have a structure of how you give those differential diagnoses. As I mentioned before, whenever there is a clinical scenario deterioration, early escalation is what they would like to hear from you as a junior doctor. There are other methods of also of answering the questions, like for example, STAR method, where you describe a situation and then find out what the tasks that you're supposed to do the tasks, and then describe the result. If it is like a handover, you can also do ISBAR, where it stands for identification, situation, background, assessment, and your recommendation. So if you just Google these, you will have plenty of examples of how these are applied in the clinical scenarios. Next slide, please. Now, these are just some of the resources that might be of help for you to go through to improve your answers. ThinkGP and online CPT for doctors, they are free, and you can use CPT like certificates if you do those the scenarios or CPTs from there. And I think somebody was asking, how do we utilize or how do they optimize the CV if they are not working? I think if you do these, it will be of at least some help, where they know, oh, okay, they've been updating their knowledge by doing these online modules and things like that. And RCH stands for Royal Children's Hospital. This guide, I'm not sure whether it is available from overseas, but locally in Australia it is free, and it's got a very good guidelines. And yeah, you can use these guidelines as a way to answer the questions. And if you can mention some of these guidelines when you are answering the clinical relevant questions, then it would be appreciated, and you will be at least regarded as more competent compared to somebody else who doesn't know about these guidelines or haven't heard of these guidelines. Similarly, Trauma Victoria is also a website where there are management plans in a very short form, and I think it would be helpful to go through to help answer your questions. APLS is another website. It is obviously, if you need to go through the course, it's quite expensive, but I have seen, or there are some algorithms, which is free of cost, and you can use them to deliver the answers in a very succinct and manner. Next, please. I think that's the end of my presentation, and feel free to ask questions if you have.
I think we were supposed to finish at 9, but given technical glitches, we might spend a couple of minutes answering questions. Bibhu, did you want to add anything to that?
I think I brought everything earlier before Bikash spoke about it, and we overlapped a bit. But a few things I want to emphasize that Bikash has already talked about, and there were slides there. Doing your homework. So the most important bit to remember is, each position is probably attracting about 200 candidates applying, right? So if you're one of the lucky ones to score an interview, make sure you make it count. You prepare it at the best you can. There's a lot of resources available. One of the links the PDF format I sent is just something, that's pretty basic, but it gives you an idea of what kind of answer you're expected to give. You can always use Gemini, ChatGPT, Cloud to ask for answers if you want. Just remember, they'll give you some generic answers. You got to modify it as much as you can. With the number of Nepalese doctors and Indian doctors around, or the IMG readiness programs, all of you are involved or attached to one of them or other, it's probably worth finding someone who is working in the hospital setting, at least at a mid-level, so you can bounce those questions to get an idea on whether the answers are correct. There's always going to be a question that you have no idea about, right? So rather than fluffing around, remember to have strategies to go around it, or at least answer some of it. Most of the new candidates who are from overseas will struggle unless you're from the UK or where the English is the first language. Remember, a lot of the new doctors are really focused on the clinical aspect. The clinical aspect is good, but it's not going to be a make or break. So don't be disheartened if you didn't know the answer. The idea is to make sure you've got some common sense. Like if I was to recruit anyone in my department, I would probably want someone who's likable, who's got good communication skills, and who's going to be a safe doctor in that 5 minutes of interview that I can assess, rather than someone who's excellent but could be a bit dangerous, could be a bit of a cowboy. Because medicine is something you've already learned. We can just teach you, upskill you over time. But we want someone who's going to be a team player, who will understand, who will listen to the instructions, and is going to be a safe doctor. The other bit that he mentioned was doing your homework about the hospital you're going to. Just Google the hospital, see if there's any new streams that's starting. If you're applying to, say, geriatrics or emergency department, see if there's any new program, any new equipment, any new department, new builds that's happening. You can just put that in saying, well, I'm really excited if I was to get a job to work in the hospital. I'm excited about working in this new department that's being built. I understand there's a new stream that's being started in the department. I'd be excited to learn and grow with the department, or something in that line, right? So it just shows that you've actually looked into that. And also to have some common sense. So if you're asked, for example, where do you see yourself in 5 years' time, and you're applying to the emergency department, you may really want to be a cardiologist or a surgeon, but it doesn't look great if you say, well, my special interest is cardiology. I would like to be in a cardiology program in my final year in the next 5 years. Well, that's great, but that probably doesn't help you to apply. You don't want to lie, of course, but just don't start to contradict yourself during the interview. Okay. If you're not interested in ED and all your CV has nothing in ED, and you say, well, I'm really interested in ED training, well, it doesn't add up as well. So just make sure you balance it out. Don't try to put a negative against you. And there was some few things about values. As an IMG, I have no idea what those values mean. So just do a bit of a background check and see what it means, read about it. And if someone was to ask you and have a question, then you'll have something to answer with. Okay. Any more questions, guys?
I might just add, one thing that you shouldn't be afraid to say is, I don't know. Like, I'd rather have someone say, I don't know, rather than give me a rubbish, wrong answer where it's not safe. So if you have anything where you have no idea what's going on, you say, oh, actually, in this scenario, I would probably, because I don't know the answer, I'd probably ask my senior colleague in the department or something along those lines, rather than blabber along around something that's completely wrong. Maybe Ram wants to add something, and Bikash, before we end, and then we can end. I'll go Bikash first because Ram's muted, and then maybe Sandesh can unmute Ram as well.
Yeah, I think I forgot to mention about, again, the cultural difference. I think somebody advised that I bring it here. For example, there may be a escalation in the ward, like a nurse not happy with the management. In that case, I think it's important to give a due respect and then have a discussion about it and escalate rather than ignoring those situations. There may be a question where they might say, okay, the nurse came here and then wasn't happy with your management. How would you approach? So I think it's important to address and prepare on those lines as well.
Yeah.
Ram?
Yeah. So two things. Obviously, if you get an interview this close, I think as we spoke, there'll be hundreds of applicants for even for a handful of jobs. So if you get an interview, it's a really, really good chance. So I think give your best. Obviously, practice a lot of questions. Practice with your friend. Practice on the record itself. Give your best. In terms of the clinical practice or clinical work, be safe. I think demonstrate that you're safe. This is about precision medicine. We do things back home as well, but they do it here more precisely. That's the difference. So you have to be safe. We're not when you're trying to be hero or for your level. As long as you're safe, you know the limitation, when to seek out for help. That's where you are valued as a team member rather than trying to do things on yourself. MDT is really, really important. So as Bikash mentioned, so listening to nursing staff, listening to allied health, be it physiotherapists, occupational therapy, social worker, whoever, if somebody's got some concern, listen to them, validate their concern. Ultimately, as a doctor, we are the one who are caring for the patient, and ultimately the decision rests on us. But acknowledge their concern, and then probably if you have to put the explanation, you have to put the explanation. But always listen to them. I mean, the hierarchy back home, back home doesn't exist here in the clinical practice. Obviously, we are probably the team leader, but everybody is looking for working for the betterment of the patient's ultimate outcome. So they are equally important.
Great. Bibhu, I'll let you end if you have any last final comments before we end.
No, I think thanks Ram and Bikash for excellent talks and the slides, and Sandesh for running it in the background. We really apologize for the glitches we've had. The last webinar we ran went pretty well with Zoom, so we decided to go it again, but we'll look into that, and hopefully the next webinar we run, we won't have any issues. I think you can, if you have any other questions, you can send it to one of us. We'll try to reply as best as we can. We won't, the reality is we are all clinicians, as we discussed earlier. We're not up to date with the runnings of how the IMGs are doing. I think you guys are probably more up to date than us among what IMGs are doing. You guys can connect with each other. I think there's a Telegram group, there's WhatsApp group, there's lots of groups that you can communicate. This program was mainly to give you a platform to learn from people who are already working in the system for a number of years, what we expect in an interview, what are the things we think IMGs are lacking when they come for an interview. So hopefully this has been an informative session for you. Please, I think there's a group that Sandesh has created that you can join to just share ideas, ask questions, network with others. And Dr. P has already asked you to join the ANMDA group, organization. It really helps to have a larger group of Nepalese doctors. I'm sure all of you will have jobs and go on to become successful specialists in your own fields in future, and probably help others join as well. Thanks, guys.
Thank you, everyone.
Thank you.
All right. See you guys.
Thank you, everyone. Bye for now.